Hey guys, so this video is about one of my patients. This happened when I was posted in surgery during my internship, and were posted in surgery for 2 months, and this patient was admitted in our ward for the entire time. Yeah, for 2 months. Actually, she was there even before I started my posting. So she was probably admitted for like 4 months. So she was admitted for this huge ulcer on the sole of her left foot. It had this layer of yellowish white pus and tougher pus that's hard to take off, which is called slough. I don't think I can show you guys a picture, but I could draw it out for you guys. So there, it was that big and had all this yellowish white stuff everywhere. So the day before I started my posting, I went to get handover, and I didn't mind this patient that much because she was just another ulcer case. I know doctors just say disease names and they don't have humanity, but I couldn't actually remember her name. And that's what happens because I was more concerned about our sicker patients in the SICU and all that. I hadn't seen her ulcer that evening because her dressing was done for the day. But the next day during rounds, we opened up the wound and we had a good look. And my professors were just like, yeah, dressing to be done, and they just moved on. So a dressing is basically cleaning the wound with betadine and saline and then wrapping it up with gauze again. After the post-round work was done, I started doing the dressing. I asked the patient herself how the intern before me did it. And she was just like, yeah, just pour some betadine, scrub a little, pour some saline, scrub a little, and cover it up again. That's all. But I kind of knew it wasn't enough. I finished the dressing and then went and asked my assistant professor. And he actually said that you have to scrape off all the slough. And that was something that no one did before. So I was like, you know what, I'm going to debride this ulcer properly. So the next day after all my work, I arranged everything. I sat next to her foot and I spent 2 hours debriding the foot. I used the back of the forceps, started scraping the layer of yellow stuff to reveal a nice, pink, healthy granulation tissue. Don't worry, she had no pain because it was diabetic ulcer and all her nerves were damaged. So now a granulation tissue is basically healing tissue. It covers up the wound after we get hurt. So there was still some slough near her heel, but I was actually a little too scared to take it off because that's where the tendons were. During the 2 hours, I was making conversation with her just to ease her through the process of someone tearing stuff out of her foot. But she was happy. No one spent this much time on her ulcer before. So the next day, I opened it up again, and guess what? It was covered again with slough. So I spent another 2 hours and I removed all the slough. And every day I used to spend this long, and slowly the time decreased as well. So in another few weeks, it probably became 20 minutes to do a dressing. I also became good friends with her because we used to talk every day. Her ulcer wasn't the only problem. We were managing her sugars because she was diabetic, she was on antibiotics, and in the middle she actually had acute kidney injury because of the antibiotics, so we had to change that. But she was doing well. 1.5 months passed and my professor gave us the okay for the split skin graft, and I was excited. She was so happy. Basically, they take skin from the thigh and then they put it over the sole of the foot. The plastic surgery team would do that, so they were informed, we were all happy. But, of course, the universe just has to show me the finger. I went on evening rounds that day and the plastic surgery team had come at 7 p.m. and written orders to reserve blood. Our blood bank is strict. They don't allow reservations after 6 p.m. And our anesthetists and our teams like plastics, they write orders at 7 to 8 p.m. during their evening rounds. So it's up to us interns to beg the blood bank coordinator to let us reserve blood. But he's just going to scold us anyway. Maybe he'll go easy on me. No, I was wrong. But you know what? I've worked hard on this. I'm not letting this go. I'm going to bring out the big guns. I'm going to call my PG and then tell him to talk. Yeah, he won't give us blood. Wait, can you ask? No? Okay. Oh yeah, I forgot. My PG is one lazy... He doesn't care about my patients. You know what? I'm just going to have to do it myself. So I realized I'll have to come early the next morning and then I'll have to do all the paperwork and get it done. So after we discharged her, she would actually send me pictures from home of her ulcer. And a part of the graft necrosed, that means it died. So she got admitted in plastic surgery again, and they did another graft, and that was good. And now she's fine. But you know what? This patient taught me something. Surgeons keep thinking about laparoscopic surgeries and what big surgeries they can do because they're more flashier than just an ulcer. But who's gonna treat these patients? Interns don't know how to dress, or they just don't care. If you're a med student watching this or an intern, learn how you can do the simplest of things, even a dressing. This patient could have gone home even before I started my posting if the dressing was done before. If we could learn things from this story, one would be that there's always a right way of doing something, from the simplest to the most complex. Even wearing your glove. If you don't wear your glove properly, it could lead to infection, sepsis, and even death for the patient. Whichever patient you treat, how much ever small their problem may seem to you, it's a big one to them. Treat them properly. If I hadn't had to learn how to do the dressing properly and was like the intern before me, her ulcer wouldn't have healed. Actually, the patient wouldn't have known that her ulcer could be healed. She would have thought that this is the best that medicine could do. I'm not showing off, but these are just simple things that no one talks about. Maybe it just becomes trivial as the doctors go up their ranks, but it makes a whole world of a difference for the patient. So I'm going to end the video here. If you like this video, give it a thumbs up. For more videos, you guys can subscribe. And if you have any questions, please comment. I'll be happy to answer them for you. Till next time.
Cause yeah, we starved. I'm on a hustle, I'm on a grind. Everything I see, hell yeah, I'm making mine.